Thank you guys for coming out today in this inclement weather. It's been a great meeting so far. I'm really enjoying it. Thanks to Russell and Maria and everybody else who's worked so hard to put this thing together. The theme for this year's meeting really was, innovation in general, but we also wanted to focus on the role of information in the life sciences, both in patient care, pharmaceutical development, as well as the medical device industry. And I think you're seeing that today. We led off this morning with a great talk by Dr. David Ledbetter, focusing on genomics and the really interesting, I would call it translational research, essentially, in the sense of taking genomic information and applying it to the actual care of patients versus pure discovery. So now we want to follow up. So that's the academic perspective and practitioner perspective. Now we're going to follow up with Robert Hendricks, who's Chief Technology Officer and Senior Vice President at McKesson, which is one of the large EHR providers, and really get you the commercial perspective on what they're doing as a business to use information, to reach out to consumers. And Robert is going to focus on consumerism, which I think makes a lot of sense, because we're seeing that really in every aspect of both patient care as well as on the business side. And I think what David was saying this morning, consumers are getting access to their genetic information, right? So that's pretty remarkable if you think about it. And they have access to lots of personalized data through their Fitbit or Apple Watch and so forth. And how does that all come together, and how do we in the life science industry participate in that? So let me say a little bit about Robert. Robert has been in the health IT industry for 25 years now. He's been at McKesson since 2004. He's the Chief Technology Officer currently and really responsible for all aspects of their EMR business and new product development and rollout. He's very active in the Atlanta business community. He's involved in the Metro Chamber and several other organizations, and gives back quite a bit of his time, and we really appreciate him taking time from his busy schedule to join us today. Robert, welcome.
So I get to be the lunchtime entertainment for you all. So, the first thing I'd like to do, I've actually, as I mentioned, participated a good bit in the community. I've put on some number of events like this myself before. So I would like to ask you to put your fork down for 1 second. One more time for the sponsors and all the people behind the scenes, please. These things are not easy to pull off, and they are clearly expensive to do. For the record, I wasn't paid for this event. It's free information, so you get what you pay for. It's interesting. I am a Georgia native. And I was coming back from a flight yesterday. And for those of you how many of you fly often? Yeah, I figured that, right? The November Sky magazine has an amazing spread on Atlanta. And what I'd like to do is, first off, congratulate you for being in one of what I consider to be the top 5 cities in the country right now. And as you read through that, if you come up with any different conclusion, please let me know, because I think what we're doing here is amazing. This event, we've got an event tomorrow focused on health IT, and there's a lot of great things going on in Atlanta. You really want to pay homage to that. The introduction did mention I'm with McKesson Corporation, but I'm also a lifelong technologist. I'm an engineer by early training, and I accidentally ended up in healthcare in my early 20s. Working actually just up the street at Blue Cross Blue Shield. I was asked to automate a underwriting application for HMOs for the quoting process. So if you know anything about the payer side, I became quite jaded immediately around healthcare and its cost structures. The other thing I need to mention is that this is kind of my fair disclosure. I don't own stock in any one of the businesses that I've seen here today other than McKesson. But I am not, this is kind of the Jim Cramer thing. I'm here as a technologist, and I'm going to talk a lot about technology and what I see as some of the challenges that are going on. Not necessarily all of my opinions that are expressed or implied represent those of McKesson. So for all of you videoing this and capturing this, make sure you don't forget that part, because I I have a child in college and another one going, and I probably need to keep my employment. So as I bring this up today, consumerism, interoperability, and the impact of analytics on healthcare, just like this morning, I was blown away with the amount of data from the Geisinger study on genomics and some of the depth that they were going through. But thank you all for inviting kind of an IT guy over to this side of the house. And you're more than welcome to join me on our side of the house tomorrow. We're actually going to be at the Waverly talking about health IT. But I'm really not here today to go in. I'm going to talk about it, but if I ask you afterwards if I were able to convey 3 messages to you, there's 3 things that I want you to hear today, and there's 3 things that are embedded in everything that I'm talking about. Number 1, healthcare technology as it stands today is on the edge of the cliff and joining with technology to do things that have never been done. And I don't necessarily mean that in advances in design. That'll continue to happen. There's been a lot of great advances. I was actually walking around just the poster board showcases, by the way, which I understood about a third of each one, okay? But I'm talking about where we are in technology in general today. I combine that with the fact that how many 34 or under in the room? Any hands, 34 or under? The millennials surpassed us, Gen Xers, this past May as being the largest percentage of the working population. And what that means for you boomers in the audience is you thought we were a problem. That news for you. So really, number 1 thing is we're really on the cusp of some amazing things that can happen. The second thing is there's a big struggle I think, in healthcare specifically because there's a lot of regulatory environments. But your identity is something I'd ask you to think about. And that's kind of interwoven in here, security and identity. If you Google cyber right now, you could go to a conference 3 times a day for the next 2 years if you wanted to, okay? I want you to think about how many identities you have, how many email addresses you have, how many identities and passwords and challenges that you have to work through. And then I want you to lay on top of that all of the concerns that we have in healthcare and all the security and the regulations that go along with it. So think about identity as we go through this conversation this afternoon. And then the third thing is really around kind of the analytics space. I had the pleasure, we were sitting talking at the table before the introduction. I have worked in the healthcare system. I have rounded with physicians. I have helped try to implement EMR systems in large IDNs. I have rounded with cardiologists, oncologists, pulmonologists, lab. Guess what? We are, even though we're pushing a lot of technology, in my opinion, we've got to let go of some of those mundane activities. However, we have to make certain that physicians have the right information to make the right decisions. With what we saw this morning with the available amount of information, so I think the Geisinger information this morning was they were targeting 250,000 genetic profiles, going to give us an enormous amount of information per each person, and there are 5.5 million people in Atlanta. There's 319 million in the United States. The last mile, as we say in technology, is always a difficult part, right? So you can have high-speed connectivity, et cetera, in big metropolitan areas, et cetera. Healthcare's last mile is that average consumer. And how do we engage that consumer? So if you think about it as we go through this today, I'm going to bring the slide back up. I chose consumerism for a reason. And by the way, all of my slide data here theoretically is footnoted. If it's not, just Google it, because that's where I got all of it, just like all millennials will, and everyone who has got a problem and they're trying to solve it, right? You just go and search for it, and it's there. Consumerism is this concept that we're trying to protect something, right? The interest of the consumer. And as you look through some of these other definitions that I pulled up on consumerism, I think this is really interesting. I really think this is interesting when you think about millennials. Salesforce recently launched. Some of you heard they're launching in the healthcare space. How many companies have you not heard lately that are going to launch into the healthcare space, right? Salesforce study was clearly focused on millennials. They quoted stats like, most millennials want to do things on their phone. They don't want to go there. They don't want to put up with this. They don't want to wait in a lobby with outdated magazines and read about the last car or the last golf magazine. So when you think about consumerism and you think about these definitions, you think about a modern movement for the protection of the consumer against useless, inferior, or dangerous products and or information that might be misleading to them. Now, I'm not claiming anything that we advertise is misleading. I want you to put yourself in the place of the average consumer. Clearly in healthcare in this room, I would argue that you all are in the top, let's call it 6 Sigma 999 position, and I'll ask you some basic questions about how you manage your healthcare. And when you think about consumer, what are they? What is a consumer? Payer, co-payer, patient. Okay, a lot of different examples here, partner, person. I think we focus a lot on the self-pay because if I read a lot of literature right now, one of the biggest jobs to be done right now is what? We've got this major shift going on, and I'm not going to read through all these facts because there's a lot of brilliant people that work at McKesson that put all this together, and it's footnoted greatly. But the bottom line is most health systems that are doing the delivery today are going to get compression. A nice word of saying they're not going to make the profit or the margins that they had before. We're seeing increases in populations, okay? So when you think about the consumer and you put yourself in this place and all these things that are going on there, you have to ask yourself a question. How many of you understand it? So let's just take what we would normally take. Simple patient profile. 46-year-old white male, family history of heart conditions, hypertension, taking medication is treated, moderate exercise 3 times a week, routine doctor's visits every 6 months, stress test every 2 years, obviously some history there of heart disease, and the BMI is 26.4, overweight, or what I would generally call slightly elevated. Slightly elevated. This is what the average physician gets to find out in the first, 37 seconds to 1 minute of being with a patient. So the interesting thing about this patient as they're working with the doctor is this patient actually happens to be me. I'm the Chief Technology Officer for the largest healthcare company on the planet. Now, I have a good friend that I went to school with who chose not to go into healthcare, by the way, but we were both in technology. I actually have 2 of them. One of them works at Disney, Parks and Entertainment. The other one went into financial services. Now, we're sitting around the dinner table having a great time. And throughout that conversation, one of my good friends, Tim, says, hey, I'm taking blood pressure medication now, I'm a little bit overweight, etc. Robert, there's all these technologies out there. How do you, the Chief Technology Officer, the largest healthcare company on the planet, manage your own personal healthcare information? What do you think I said? Think about it. Think about it seriously for a second. I want you to seriously think about it a second. I'm an engineer, I'm a technologist, okay? I've got no less than 6 apps on my phone, okay? And by the way, I've tried, and I'm not bashing any vendors, I've tried Health Vault and a lot of others in there to try to pull it all together, but at the end of the day, there's important things to my doctor. Lab results, trending of lab results. You ever notice if you have lab results, all those ranges that are important? You know what? I think I have my own range. That's just me personally. I think my doctor also believes that. So this is the complexity that I'm living in as a consumer, and I, by the way, am supposed to be good at this. I just want to lay that out there for you for a second. Now, I'm dealing with a doctor, and I love this quote, by the way, and I give it credit. We just converted over to ICD-9 to ICD-10, big systems, powwow. The interesting thing about this quote as I read it, so what about ICD-10 makes it so much better? Well, for starters, it has more diagnostic codes, about 68,000 compared to 13,000. And in this case, more is definitely better. More is always better, right? Why? Because with more codes, medical providers, including everyone involved in the healthcare continuum, can more accurately document clinical information, including patient diagnosis. Now, I want you to think about that for a second. I visited some physicians recently in a health implementation, new EHRs. We're doing some stuff around the EHR, not even our EHR, by the way. We've turned them into stenographers. I mean, I used to get beat up when I was a CIO at a large IDN. If I walk into a health system now, if I take one of my children to the hospital now and go to the ER, if these people find out where I work and what I do, as soon as my child is stabilized, by the way, thank you, they want to show me around how difficult we have made their lives. Now, I want you to think about that in the context of what we talked about this morning with Geisinger. I want you to think about the life of what it looks like to add exponentially more data to that day, exponentially more information there. So as you look at this, we have to shift away to more simplicity. I'll give credit. Had a good mentor years ago when I lived up in New Jersey, a gentleman by the name of Ron Ponder. Ron Ponder was a CIO for AT&T Worldwide at one time, I believe. He was a CIO for FedEx during the barcode days. I mean, he's got some claim to fame there. And Ron gave me some good advice one time. We got into some technology conversations. I was trying to convince the board of that health system to spend probably $8 or $9 million, and he took me to the side and he said, Robert, I'm going to tell you one word of advice. If you cannot explain this to your grandmother and she understands it, you are not going to sell this. And I want you to think about where we are right now in healthcare today. And I want you to think about that consumer today. And I want you to think about their engagement. So I guess your first question is, you compare and contrast this to the doctor, but, is there any hope in this scenario? And I give credit to the IOM study, and I give credit to the bottom. I did steal this slide. Mark's in the audience. He got, kudos this morning. I had Mark at our TechCon event last year for McKesson. We bring our top 250 technologists together across worldwide McKesson every year, and I get the pleasure of working with them for 3 days, trying to figure out how we're going to solve the next thing and do with the next thing. And we had Mark there talking about it, so I did steal this graphic from him. But it's interesting that the IOM vision and for the IOM study, this is really simple, right? That's why I love this graphic. We basically need adoption of technology. Have we had that? Had a lot, according to Congress. Billions, right? What have we got for it? Depends on which congressman you talk to. What are we lacking? This thing called interoperability. And interoperability is going to facilitate this population dynamics around analytics, because ultimately, what do we want to do? We want people to be healthier. We want to be able to know what's going, exactly what they're doing. You want to be able to predict things that are going to happen. You want to help people ahead of time. Every physician I've ever rounded with, every nurse I've ever talked to, every station I've ever stood at, every lab and internal medicine person who has chewed me to the ground did it for one person, for one reason, and that was the fact that they really cared about patients, and they wanted the patients to live longer, happier, etc. So from a technology perspective, I think this graphic is extremely easy when we start talking about something called interoperability. And you all are probably hearing a lot about this. Don't know if you've heard a lot about it on this side of the industry. I think you have. I'm going to explain it to you in real simple terms. If you want to get really deep on it, you can come next door to the IT Summit tomorrow, and we'll get really deep into interoperability. But interoperability is this new buzzword. It's pretty simple. We got a lot of adoption, bought a lot of systems, put in a lot of data. Nobody shares anything. Nobody can use anything. We have forced, no matter how many times we tried to implement EMRs by best practice, what is something that you think makes healthcare and physicians really great in the United States? I think it's their experience and their ability to make a decision personally. We've all had those examples in our personal lives, right? Where if we followed a particular protocol, or we followed what we found on Google, or if this happened, then you would have had an adverse effect. You want physicians to be engaged in this process. Well, technology is really good at doing what? Taking a process, breaking out the problems in it, streamlining it, and making it highly efficient. We've got a problem here. That's not the model for today. It cannot be the model for tomorrow. And so when I take a look at this chart on interoperability, I want to talk a little bit about what interoperability really means and try to give you a simple explanation to it. Number one, how many of you in the room understand what the internet is? How it works? You know why we have an internet? You know how it happened? See, now you feel like I felt when I was reading those posters out there. It's okay. We can walk through the OSI model if you want to afterwards. But At the end of the day, the internet and interoperability is about that hourglass effect. Now, the hourglass is the example of the internet. It basically is that we had to get to a homogeneous state in the center where everything could exchange. And that was IP, the Internet Protocol. That's what started it. That's what started the internet. Before that, we had what? A lot of different systems doing a lot of really cool stuff within the silos of their own systems. This is exactly what interoperability is going to have to be in healthcare. Now, IP for the internet, we call it FHIR. F-H-I-R. It's not spelled the way you think it would be. But if you Google it right now, if you go to anything at Georgia Tech, if you listen to any of these health IT forums, interoperability FHIR coming out of HL7 and the government's pressing as well. This is absolutely why I would tell you that we're standing on the edge of changing healthcare as we know it today. What does FHIR do? And of course, you can think about things that, parsimony here is defined as basically the simplest and most economical way. So in other words, we do things, when you don't have strategic advantage, why do it? This is how open source kind of got started. As we go up that food chain in there, we're all looking for how do we differentiate ourselves and articulate value in there? I would say that the healthcare technology systems are going to do this exact same thing as we've seen on the internet. Okay, so as you think through this diagram, FHIR's in the middle. That is what interoperability is going to be. That's why there's so much excitement about it right now. So when you think about this, and you think about this as a vision, you begin to dissect interoperability into, okay, what are the challenges? Well, first off, let's just assume that either we're going to stand up and do the right thing as an industry, or either the government's going to force us. One of those is going to happen. About data blocking, just Google it, you'll see a lot of stuff out there about it right now. But interoperability is really analogous to the financial services industry, right? So the EHR of today, and we have one, even though we don't have the leading one, I'm not going to take anything away from anyone. Their biggest fear is they're going to become the mainframe of financial services in the next 5 years. They're going to be in the back end. Okay? Interoperability is the opportunity to experiment. So let's dissect that a little bit. Usability. Number one complaint you'll hear from any physician in any organization, any nurse, is how unusable the system is. Now, it may be usable for the 5 people that helped you design it, but it might not be for the other 5,000 in the building. Let me talk to you about usability for a second. Usability is how, in healthcare, people will die. You pick a wrong button. So what do we do in the IT world? We give everybody an alert, right? We were talking about that. Any physicians in the room, how many alerts does your EHR give you when you start making decisions? Are you smart enough? Do we need to alert you to everything? Usability is going to change dramatically. And I'll give you the shift here. So what interoperability is going to do is it's going to open up a door to sharing of information. That information is going to be standardized. It's got to be secure. I'll talk just a little bit about that because that's pretty much a conversation within its own. But when you think about workflow and you think about usability, I want you to take off your name badge and set it down. And I want you to think about what you do in your daily life today. And if that doesn't help you, I want you to think about what your children do in their daily lives today. And I want you to think about this millennial population coming along. I download an app and I don't like it. What do? Delete it. If I'm really mad, if it's really bad, I might actually even rate it. Tell everybody else, don't waste your time. Okay? I would tell you right now that if I took 25 really super great engineers and I took 25 of the world's greatest cardiologists and I put them in pairs and said, you go off and design the mobile app for cardiology that's going to be the best one in the world, how many different mobile app usability workflow components do you think I would get back? 25. And I think, from a physician's perspective, that physician that has experience and knowledge is what saves people's lives. We can't continue to force them down a particular road of doing things in a consistent way. Now, there's obviously things that need to be captured, and there's regulatory oversight, and I'm not going to get into that. Everyone all knows that. But the bottom line is, how do people practice medicine is different based on their experiences. And I think we should stop, as IT vendors, we have to stop trying to say we have the best one. And through interoperability, what you're seeing right here, and through usability, we've got to figure out how to pull the data that's relevant, we've got to bring it to their presentation, and we've got to make their day fluid. Now, the only thing that we've got to solve for this is it cannot just be the data that you have in your EHR sitting in Atlanta, Georgia. Our world headquarters is in San Francisco. I've been to the ER twice out there. What do when I show up at the EHR? Security and identity, right? What happens when I show up at that EHR in California and I'm like going through some major trauma, I'm having a heart attack maybe, okay? What do they know about me? Seriously, for a second, what do they know about me? Any ED docs in the room? I love hanging out with these people. They're the most intense group of people I've ever hung out with in my life, okay? These are trauma people. I show up, and let's add to that, I'm unconscious. Add to that. Have you seen these people that tattoo their medical records on their body so they don't die? I mean, we've had a ban, but think about that for a second. How do we solve the identity crisis? How do we solve the workflow process of each one of these disciplines? And how does it make it usable for each one of those specialties is where we are right now. Have we solved it yet? No. But through fire and through congressional pushing and through a lot of vendors pushing on what is going to be right, and great universities like in Atlanta taking the lead on a lot of this stuff, this is going to change healthcare like we've never seen it before. Back to my original point. How do we engage the consumer? Because I know a lot of you are sitting here thinking, you're saying, well, Robert, if we've had Moore's Law, the banking system, I got mobile apps, I mean, I got apps that help me do everything nowadays. How in the world have we not solved the problem of healthcare with technology today? I mean, we got clouds, we got buses, we got all those things. We got a lot of acronyms, right? So how have we not solved that? And what is the biggest issues that's out there? How do we reach 320 million people to engage in their own? Let's just do the 80-20 rule. How do we engage the 20% that are representing 80% of the cost? Doctors in the room, medication adherence. Do they take their medicine? Do they do what they were told they would do? How do you solve for that? Well, what are we doing today? What is value-based reimbursement? Can please someone tell me? I don't mean that in a negative light. I'm in this industry. I know what it is. I know what we're trying to do, but I'm also trying to tell you, how are we going to reach that consumer, which is impacting their own personal health care every single day? We're going to do it through availability of information, and we're going to do it through sharing that information and engaging with that consumer in their own personal outcome. So I like this part. So when someone says, well, with all the technology, Robert, why haven't you solved this problem already? All these people, why haven't you solved that problem already? I'll tell you the same thing that any doctor would tell you, any nurse would tell you. It's because they're humans. And if we blow it, somebody dies. That's serious. So we don't experiment a lot with this stuff. And with all the work that you all are doing, I don't know this side of the industry as well as I probably should. You get that point. Clinical trials and what we have to go through and what they showed this morning, how do we advance through that? This system has challenges in the sense that I can't create an app that's going to absolutely have a tethered component that's monitoring someone's heart, that's also taking blood samples, because by the way, we could probably build one of those, right? And make recommendations to them. But if we make one false interpretation or one reading, a human could die. Not to mention all the risks that goes along with that. I know there's always at least a couple lawyers in the room, and by the way, I love them, they're great, they keep me out of trouble. But you understand that's why this has been so difficult. So, as a technologist, when someone starts pounding on me about, how do we solve this, Robert? I could tell you right now, if you left this up to a technologist, you could probably solve this today. I'll take myself as an example. I'm a 46-year-old white male. Anybody know what geofencing is? Geofencing is that thing that your wife has, or I say my wife, I'm married, it may be your husband, I could be wrong, significant other, that every time I drive by a particular store that has a sale, it goes cha-ching like a cash register, and tells her that if she comes in the next 15 minutes, they will give her a 20% discount. The technology that knows she is there, that she accepted, is easy. Okay? So we're going to take geofencing, number one. Number two, we're going to take my own personal demographics that my physician has given me. So I know what bad shape I'm in. Remember, I'm slightly elevated. Okay? I'm not overweight, I'm slightly elevated. And I'm working on it. The other thing I'm going to do is I'm going to go to Fitbit, and I'm going to take a lesson from my dog. My dog's got a collar that when I put him on and put him in the yard, those little white flags, he just never goes by. Okay? So Fitbit, if you guys do this, at least give me credit on this. I want that shock in that bracelet. I want the shock, and I want the vibration. Okay, and then I want my phone. We're already plugging in apps on your phone with car insurance that they watch how you're driving every moment of every day, and if you drive halfway decent, they give you a better rate. Just apply that to healthcare. So here we go. Robert, I got in proximity of my Fitbit to my elliptical this morning. They know what my heart rate was. They know I exercised or not. Okay? Instead of 30 minutes, about 20, I slid off, got a glass of water, thought twice about getting back on. What do I get? A little vibration. Okay? What's the second thing I get? A little jolt. And if that doesn't work, what's it going to do? It's going to text my wife. Okay? So if you want technology to solve this problem, I can solve it for you on the extreme side. The other thing that it does with this geofencing is I'm on my way home, and I did a bad thing at work today. I skipped lunch, shouldn't have done it. Had this really important meeting I had to go to, right? It's always an important meeting where you don't eat, and then near the end of the day, you're starving to death. So I make the mistake of driving into Zaxby's. Vibration. Notification to the wife. Instantly. I'll tie one in for you better. They all got electronic signs up there. I pull up, the menu changes. I want you to think about that for a second. You think this is funny, but I want you to think about this for real for a second. If you want to talk about how to manage a population, right? How are we going to do that? All right, so me being an astute consumer, I know you've got fried chicken. I know there's salads on the screen, but I know there's fried chicken in there. Give me the Big Zack snack. I need it now. Sorry, sir, it's not on the menu. Yes, it is. Don't make me come in there and pull the chicken out. Okay? By the time I get up to the window, I've received 3 shocks. My wife's been texted twice. Visa Transactions knows I'm there and is declining my transactions. So if you want me to tell you how to solve population management as a technologist, we can solve it today. We do it for our pets already, right? How many of you have that pet thing where you can sit at work and you can pull up that mobile app and see how much your dog's been napping? Have you seen that one? I think that's hilarious. I think that is hilarious. I want to take that and put that on my mother-in-law. Okay? I joke about this in all seriousness. I'm a technologist. I'm not a physician. I'm not a scientist. Okay? This is complicated. This is really complicated. But in closing, before I take questions here, we're on just the point of some technology that's going to make data available that is absolutely going to be essential to making it simple and usable, not only for the physicians, but also for the consumers. You've got to get them engaged. Geisinger's got a great model, and you heard him talk about something this morning that I thought was extremely important. They're trusted. And that's key. They're trusted. Okay, so how many of us, when we start doing these health fitness apps, do we trust the app? I use MyPlate for one thing. I use a blood pressure monitor thing for another thing. I use Health Vault for some things. I got to be honest with you. I train my lab results in Excel and keep it in Dropbox because I like to see the graphic. I'm a graph guy. I don't know. Just the raw numbers don't help me. I can sit down with my physician and we actually have an engaging conversation. And I've changed primary care physicians, as you might imagine, more than once. The latest young lady I have, I think, is phenomenal. She actually asked me when I show up, pull up your app. Let's see where your blood pressure's been. Show me what fitness you've been doing. Show me what calories you've been consuming. You're still slightly elevated, Robert. I'm trying to help you, right? Do I need to call your wife? But with all seriousness, I think what we have is we have an opportunity from a technology perspective. I would argue that in the next 10 years, fire and interoperability is going to change this, and I am so excited about it. I've been a technologist my entire life, and sometimes I wish I went to work for Disney, because it'd be nice just to have a cool idea and go do something, right? In healthcare, we have cool ideas, and then we have regulatory environments, and we have to work through them. But this is, I think, going to be the key thing to it. The second thing I would tell you is your identity. Your identity and finding out who you are, knowing who you are. I always get people argue about identity, and they talk about HIPAA, and they talk about security and penalties and so forth and so on. How many of you ever had I thought it was interesting, and I saw it in your information too. How many of you have ever had a family member diagnosed with cancer? What's the first thing they do? They go to every social media outlet on the planet. They go to every web thing on the planet trying to find people who've been through this before. Now, I have to be honest with you, I don't think any of them really care at that point about the security of the information. Now, I know we've got to protect it from misuse, but I want you to think about your identity and managing your identity. I personally have 5 email addresses. I got one I use for not-for-profit. I got one I use for junk. I got one I use for real personal stuff, and I got one at work that I try to use for work, but it's got a lot of stuff in it that I don't really need to pay attention to on a daily basis. But think about your identity, because managing your identity and understanding your identity and protecting your identity is going to be a key component. And the last thing is really the ability of information and what we're going to be doing with it from an analytics perspective. We have got to move physicians and really intelligent people out of the world of doing mundane activities. They've got to get past data entry. They've got to get past 77 alerts in the system. They've got to be able to go back to treating the patient. There's a shortage of physicians. There's an increase in the number of patients. These are all math equations that are even my 10th grader can figure out. They're not sustainable. So it's up to us in this low percentage of the population who understand healthcare to think about it being bigger. But most importantly, I would tell you every day, think about it as you. When you go to work, think about it as you. Think about how you're using your technology every day, how you use it in your personal way. And you need to think about how we're going to do that in the future as well. I thank you for your time today, and I'll take questions if anybody has any, but I reserve the right to refuse any question at any point. Thank you.